whether or not we can use the information for YouTube. So, I'm sorry, say it again, Mel.
I'm guessing that we would be able to use it for the YouTube.
Okay.
So let me, just to be sure, get back in touch with the teacher. That's awesome.
No, all right, let's go to what everybody's been waiting for. Yay, right? Myself, Joe Grayson, and Deborah Ramirez and Marie Allison are going to be talking to us about genetics and autism and what's new. So I'm looking at my controls up here to make sure that nobody's waiting to get into the Zoom room.
And also Delwyn Jacoby?
Yes.
Yes.
He's here too.
Yeah.
Okay.
I am here. I am here.
Okay, I can't see you.
I am here. Now I'm here. Hello. That's a fake exam room back there, let y'all know.
Okay, awesome.
I use that with my telehealth visits, so so it's fake. I am at home.
I can't see you.
Hi.
Hi. So if at any point anybody has any questions or anything like that, definitely feel free to ask us. And I still can't see your face because I can only see 4 faces at a time for some reason. It's so weird. Okay. There we go. Now I can see nobody. Yay. But I can hear all of you. So genetics and autism, what's new? Oops. Let me go back here, one slide. So this all started because my son, Thatcher, was recently diagnosed with Christensen syndrome. So Thatcher is my son, and in July of 2012, Thatcher was diagnosed with autism. It was called classic autism under the DSM-4, and later his diagnosis was updated to ASD level 3, needing support in all areas under the DSM-5. And if you don't know what the DSM-5 is, it's the most current diagnostic and statistical manual for mental disorders. So this is like what you would need clinical diagnoses for. This is like autism. When a person is diagnosed with autism, they didn't like take blood from that person and say, oh, boom, you have autism. You know, they have to like go through all kinds of clinical things to determine that. And so most of our community should know that. In October of 2019, Thatcher received a genetic diagnosis of Christensen syndrome, which is a rare genetic mutation of the SLC9A6 gene, which causes the NAG6 protein to not work properly. It was also found that I am a carrier of this X-carried gene, and only around about 80 to 100 people worldwide have this condition. And so there's me and Thatcher. We're at the Hard Rock Cafe in Atlanta, Georgia. The food there was crap. Don't waste your money or your time. And they messed up our order. So because Thatcher and I have celiac, we have to follow a strict gluten-free diet. Okay, so in order to find this diagnosis, a number of things happened. And this was over several years. One of the things that happened was I put Thatcher in Special Olympics track because he was a wanderer, but he was not able to run like he had in the past. Like before he could sprint, and all of a sudden he couldn't sprint. And then a trip to the Cincinnati Zoo on Mother's Day in 2018 made it clear that Thatcher was having trouble walking like other kids his age and needed a wheelchair because he was having a lot of trouble walking any significant distance. And by significant distance, I mean like a grocery store trip that most people could handle, he could not handle. And his first cousin was diagnosed with Ehlers-Danlos type 3, a rare genetic condition that causes problems with connective tissue. So what happened there was I noticed that Thatcher had some, he had some hypermobile joints, but he didn't have enough to qualify him for a diagnosis of Ehlers-Danlos type 3, like his cousin. We went to the neurologist, and I had this list of all these genetic conditions that were in my family, including Ehlers-Danlos type 3. His neurologist sent him back for genetic testing, and they did an extensive genetic test. That's how they found Christensen syndrome. Here's Thatcher with his cousin Micah. This is the kid who was diagnosed with Ehlers-Danlos, and his service dog, Saul. So Thatcher does have a service dog. If you want to know more about that, there is a video on YouTube that is, it's on our YouTube channel, and you can check it out there. Or you can just ask me. I'm totally cool with answering any questions about that. So I've already said that. So months of waiting, we found Christensen syndrome. So what does it mean for us is it means that Thatcher's going to get better treatment and possibly a better outcome and possibly a longer life. So life expectancy is shortened with people with this condition. However, knowing that he can have odd types of seizures, that he can have certain issues that we didn't even consider before, what it does for us is it allows us to know who to go see, what specialists to see, what those doctors need to look for, and so it could possibly prolong his life more so than without this genetic diagnosis. And so Marie, I'll let you take over because this slide's about you and Chris.
Okay. So I wrote up something different than what's on there, so I'll just go by what I wrote up.
Awesome.
So Chris was deprived of oxygen for about 4 minutes when he was born in 1975. I knew he would have problems because of that. He could say 4 words by the time he was 9 months old when he had his first seizure. He lost those words by the end of a year and has not talked since. He was having seizures every 15 minutes for about 3 years. He would have them, we would change medication, he would stop having them, then he would start having them, and then eventually it would be every 15 minutes again, and then we went through that process. He still has seizures. They're not under total control, but they are under better control now. He's having them maybe once a month now. When he was born and when he was having the seizures, Dr. Clark told us that Chris had demyelination, which meant that the myelin was not being deposited where it should be. He thought Chris had a genetic condition and that would cause his death in a short period of time. He told us to put Chris in a home and have another child. There was another doctor, Dr. Mugenhassen. She said she disagreed. She told us to hang in there, and we went by her advice. So when he was in the hospital for seizure control, it was discovered that Chris could not hear. Chris was diagnosed as being deaf and blind when he was 2.5. He went to Cardinal Hill Hospital in a deaf-blind program for 2 years. After we got his seizures under better control, he was able to see, so he no longer qualified for the program. Chris was labeled as mentally retarded, which is now developmentally intellectually disabled, hearing disordered, visually impaired with seizures. His eyes were not centered when he was young, and we had to wait till he was 21 till one eye centered, and then we did surgery on the other eye that made both eyes centered so they could coordinate. So when he was 23, Denise Keene told us about a book she was reading about an autistic child. She said it described Chris perfectly. So I read the book and had Chris evaluated, and Myra Beth Bundy said, yes, indeed, Chris was autistic. So I thought I had all the answers to Chris's situation, except his seizures, which continued unabated. So in 2019, I went to a meeting at the Autistic Society of the Bluegrass where a pediatric geneticist discussed the genetic causes of autism and seizures. After the meeting, he told me he thought that Chris might have a genetic basis for his disorders. And I told him I thought being deprived of oxygen for 4 minutes at birth pretty much explained everything. And he said he still thought Chris should be tested. I asked him how much it would cost, and he said several $1,000s. And I said, no, thank you. Chris wasn't a pediatric client anyway. But he said that he thought Medicaid and Medicare would pay for it. So I decided that I would go ahead and have him tested. So I went to see Dr. Paul at UK. And when he interviewed with me, he asked questions about Chris being flat-footed, about Chris having mobile joints. And he said that Chris had long ears. And then he looked at me and he said, but his mother does too. So I was highly offended at that. Anyway, I went to the Friday night group and told them about it. And Patty Logston said that sounded like Fragile X, that the doctor might think Chris had Fragile X. So I expected that when we got the results, I would find that Chris had Fragile X disease. But when I went for the results, I found out that Chris did not have Fragile X, but instead he has a PIGA variant on the X chromosome, and that I was a carrier. So it's complicated. I could read the complicated explanation of what PIGA is, but basically it encodes for a protein that's part of an enzyme complex that catalyzes the first step of the GPI anchor synthesis process. The bottom line is that it results, if the PIGA is mutated, it results in symptoms. And they can include myoclonic seizures, significant developmental delays in motor and verbal skills, muscle tone abnormalities, cortical visual impairment, difficulty swallowing, and delayed myelination, all of which Chris has. So Chris had been to the hospital twice with items stuck in his esophagus when he was younger. So I found out when I went on the research that as of October 2018, there were only 30 people worldwide diagnosed with the PIGA variant. I read that severely affected patients die within the first year of life. And it's, quote, others may survive until adulthood, but have significant intellectual disability and seizures. Chris is 45. He has significant intellectual disabilities and seizures. So UK sent the results to the Mayo Clinic, and their results were the underglycosylated transferrin in this sample is slightly elevated, but not as elevated as in most patients with a congenital disorder of glycosylation, CDG. So perhaps that's why Chris survived his first year and he's lived to be 45 years old. So now that I know what causes Chris's conditions, not much has changed. He still participates in swimming and basketball with Special Olympics. His basketball team, the Dragons, were the regional champions and did not get the opportunity to be state champions due to the COVID-19 situation. He still participates in activities with the Lexington Therapeutic Recreation, still gets music therapy twice a week, massage therapy every other week. This is other than COVID-19, and plays with Lysotop Soccer in the summer. He owns his own business, Chris's Canine Cookies, where he bakes cookies and sells them to friends and events. Still goes to church on Sundays. So he still carries his quarter with him everywhere he goes. However, having been tested, I now have the peace of knowing that his problems were inevitable. I know that providing him with excellent interventions helps him to have a productive, happy, active life. That's it.
Very good.
All right. So that is Chris in a nutshell. Chris is awesome. So
Mhm.
we'll move on to Miss Deborah Ramirez, and she'll talk to us about her 3 boys.
Okay, well, my name is Deborah Ramirez, and yes, I have 3 boys. I think that at this point in time, I'm the only one with 3 siblings with Christensen syndrome. And if I were to start at the very beginning, we'd be here all night. So I am going to start at the beginning, but I'm going to give you a synopsis of the whole ordeal I've been through. In 1990, I gave birth to my daughter. I have 2 neurotypical children who are thriving, participating in college. One is in the business sector and doing quite well. And I have the 3 boys that live with me. When I got ready to have my second child, I didn't think much about it. And then I had Jacob, and from the very get-go, he was very different. I couldn't hold him. I couldn't feed him the same way anybody else would feed him. So I knew something wasn't right. Something wasn't quite right. And it was suspected as cerebral palsy. So knowing what cerebral palsy is and how it's diagnosed and what have you, I didn't think too much about having my third child, who was a neurotypical. So still along that same line, we were still thinking cerebral palsy because Jacob was the only one. And so when I got pregnant with my 4th child, I didn't think anything of it, to be real honest, because cerebral palsy is a one-time, or most of the time, a one-time thing. So I never gave it a second thought. Once I had my 4th son, Gabriel, and he started missing his developmental milestones, then I started thinking, this is not just cerebral palsy. This has got to be something different. So I sought out some of the most renowned geneticists, at least in the area of Texas where I came from, and started genetic testing when Jacob was probably 5. So Jacob and Gabriel were being tested probably every other year for a good long while of every X-linked syndrome you could think of. And at one point, they finally decided that they must have Angelman syndrome because they hit all the different characteristics of Angelman syndrome. So I thought that I had found the answer. This was perfect. We had found the answer. This was it. So we went for the methylation studies and the fish studies, both. And to our dismay, they came back negative. But it made no sense because they fit the same characteristics of Angelman syndrome. I went as far as joining the Angelman Syndrome Foundation, a vast Facebook group, made friends, could really relate to all the different Angelman syndrome parents, some of the things that their children were going through, trials and tribulations we could totally relate to. It also gave us, by using it, even though we had a negative test results, we used it as a baseline to set up our goals and skills in the school setting. When we got ready to do IEP goals and skills, we struggled because what did we have? Did we know that we could speak, or could we speak? Were we going to be reliant on ACC for our communication? We had nothing to base it on except for Angelman syndrome. So we would use that as our baseline, and that helped us formulate our skills and goals that we would set each year while the boys were in school. And then 6 years later, I got pregnant and had my youngest, Elijah. At this point in time, we knew that we had to find a reason because, well, first of all, that was my 5th child and I was done. No more. I'm not having more children. But then when it was found that he had obviously the same condition as the other 2 boys, it was very clear we needed to find an answer, and we needed to figure out where we could do testing and who we were going to do testing with, who would be committed to helping us discover what this was and how we came across it. You know, so we would make an annual trip from Dallas to Houston annually to see what kind of scientific discoveries had been made that year, and whatever was available was what we had our kids tested for, one or the other or the other. We tested for every single X-linked syndrome that is available, and with each testing they came up negative. So in 2010 we made our annual trip down to Houston to Texas Children's Hospital. We met with our genetist, Dr. Pacino, and he was so excited. He had found the answer. He knew it had to be Christensen syndrome. So he asked if he could, he always asked politely, can I test them for this syndrome? I committed to it and I signed the papers, and we tested Elijah. He was the next one up to be tested for whatever was available. So that we tested Elijah for Christensen syndrome. 3 weeks after the test was done, I got a phone call from the genetics counselor who let us know that the test had come back negative. And in the middle of the conversation, she had to hang up on me because the doctor who ordered the test was about to faint in the floor because he was unbelieving. He just could not believe that the test came back negative. But yet, and we were told at that point in time we would just have to wait and let science catch up with us because he didn't know what else to do. So in the meantime, we decided that the best thing for us to do, because the heat of Texas was taking its toll on us, we moved from Texas to Vermont. While in Vermont, we got set up with a neurologist over at Dartmouth in New Hampshire. And things were moving along. We'd gotten settled in. We'd gotten settled in with the school system, and we were being seen by the neurologist. Everything was moving along. And then lo and behold, I got a call from none other than Dr. Pacino down in Texas at Texas Children's. He had chased us down in Vermont because the whole exome sequencing had come about. And he said, I really think that this is our best shot. Would you be willing to do this? I said, Dr. Pacino, we have moved to Vermont. He said, no problem. We can do the testing from there. I said, okay, fine. Send us the test kits and we'll make it happen. So we sent the testing off, and 2 years later, in the meantime, the doctor that we were seeing at Dartmouth, he wanted to see all the different tests we'd had. He wanted to see if he could figure out the answer. If somebody else couldn't, he wanted to find the answer. So I made arrangements to get all the testing and all the information on every test that we'd ever had sent to me via email. I provided that to our new doctor up in New Hampshire. And after reviewing those things, he said it's got to be Christensen syndrome. There is no other answer for it. It has to be this. I said, but we tested for that and it came up negative. Now we are doing the whole exome sequencing test, but we haven't gotten it back yet. He said, well, in the meantime, do you mind if I test one of the other boys for it? And at this point, I thought, what could it hurt? It couldn't hurt anything. So we went ahead and tested Gabriel for it in April of 2014. And by July of 2014, he found the answer, which coincided with the same time that the whole exome sequencing test came back with also the same answer. So it was a false negative that was performed in 2010 because all three boys with the same place on the mutated gene. So they all three have the same variant that indicates Christensen syndrome. Luckily, in the process, we went ahead and had my daughter tested to make sure that she wasn't a carrier, because I am a carrier, quite obviously. But it is found that I'm a spontaneous carrier. My mother is not a carrier, nor are my sisters or my daughter. So I am the only one. And then I passed this on to my three boys. So finally, does it change anything? Not really. We still live our life the same way we have all these years. I still raise the bar of my expectations of what they are capable of and what I expect from them. I go about my everyday life the same as I have. It really didn't change a whole lot. On the other hand, it changes so much for the future of my daughter. At this point, knowing that she's not a carrier, this gives her hope that this is not something that she could possibly pass on to her children and have to have the same kind of life that I have lived with these three boys. I have no regrets, none whatsoever. I love all my children very much so, and life goes on. And we now have a diagnosis and a newfound Christensen syndrome family. That's it.
All right, thank you, Deborah. How does a genetic diagnosis help? Of course, we've heard some different things. For some people, a genetic diagnosis can lead to better treatment options for those with a specific disorder. It can also help researchers better understand genetic mutations through studies of different disorders caused by genetic mutations. And in some cases, genetic testing can help inform carriers of mutated genes and help them make decisions about having children, such as in Ariel's case. So these are some reasons why you would want to get genetic testing if you suspect that there might be a genetic difference in your child. So what do we know now? Over 7,000 genetic disorders have been discovered. Most rare diseases are genetic or have a genetic component. So we know Christensen syndrome is rare, and so is PIGA, which are two genetic variants that cause some autism traits, two genetic disorders that cause autism traits. So for many rare diseases, signs may be observed at birth or in childhood. So in the case of Thatcher, he showed signs very early on that he had something different about him. We just didn't know what it was. Many rare diseases result in premature deaths of infants and young children or fatal in early childhood. So we know that many of us are very fortunate to have our children live to adulthood and even to middle adulthood or even to an old age, which is great. But researchers really don't know why there are these premature deaths in some cases. Sometimes they can attribute it to things like seizure disorders or something like that, and sometimes they just can't. So several genetic conditions such as Christensen syndrome and PIGA are part of or closely related to autism. These are including but not limited to Williams syndrome, Fragile X, Landau-Kleffner syndrome, Prader-Willi syndrome, Angelman syndrome, Rett syndrome, and tardive dyskinesia. So all of those have some things that look very much like autism. And so some of our kids can identify as both having the genetic difference and autism at the same time, because of course autism is diagnosed using a completely different criteria than genetic testing. So this is the rare disease awareness ribbon. It's zebra stripes. If you didn't know that, there you go. So about research, many studies are currently being done to discover causes and treatments of autism spectrum disorders. One such study is SPARK, which is the largest genetic study of autism in history. Thatcher and myself and my husband are taking part in that study. However, that is obviously not where we got our Christensen syndrome diagnosis. We were not told of any genetic causes for his autism by SPARK. So if you are taking part in that study, but you still suspect that there might be something genetic going on, and you want answers, don't wait for answers from that study, because they have so many people in that study. It's going to be very difficult for them to contact every single participant who has a genetic variation to inform them that they have one. Other studies are being done worldwide on conditions related to autism, such as the ongoing study of Christensen syndrome conducted by Dr. Eric Marrow of Brown University, and that is in Providence, Rhode Island, if you don't know. Once a genetic diagnosis is confirmed, patients can apply to research studies related to the disorder to help further research, education, and treatment of your child's condition. So not only can you potentially help your own child get better care, you can also potentially help other children get better care as well. So here we go. The presentation is over. I don't know what this is, sorry. Lots of things on my screen here. Okay, I'm gonna stop sharing my screen now and go back in. There we go. Okay, so does anybody have any questions for us at the moment? Any questions?
This is Mel. I have a question for Delwyn.
Sure.
Thank you all. That was an awesome presentation, you guys, in terms of your journey and getting this information. But Delwyn, are you seeing more families coming back and having one initial diagnosis and then returning, the kind of like what Joe and Marie and our third speaker from New York.
Deborah.
Thank you, Deborah. Sorry.
Okay. Yeah.
But are you seeing that more so as
Sure.
the science is improving?
Yes. Yes. Can I just, and I enjoyed your all's presentations, because I'm Delwyn Jacoby. I'm one of the nurse practitioners in genetics over here at UK, and one of my, and everybody knows this, that works with me knows how much I love developmental delays and working with those and the families with autism spectrum disorder who receive those diagnoses. And I will say that I always tell parents when they come to see us, let me back up a minute. And somebody said something really important, that the DSM-5 diagnostic criteria for autism spectrum disorder is based on what we are seeing as interactions and that sort of thing, you know, the limited socialization and speech and all those sort of things. And there are very clear criteria to meet that. However, I always tell patients that I see in families that there is autism per se, and then there are genetic disorders with autistic features. So in the referral that we get from developmental peds and from the providers in the community who they have kids with global developmental delays, they refer them to us in genetics, and there's two things that I really focus on. One is, yes, I see that there's a lack in or delay in socialization and or speech. However, I am there to look and see if I see any unusual features on them phenotypically. That's the outward expression of things. So in the genetics appointment, not only are we saying, yes, I agree that there's a global developmental delay or there are autistic features. However, are there other things like where the ears are located? Are there seizures involved? Do I see changes in the hands and feet? I'm doing a really thorough and closely observed neuro exam. So not only are we just there to take a to do genetic tests, but we are also there to look at other things too. Now, there are recommendations by the American Academy of Pediatrics and the American College of Medical Genetics, both, that the genetics evaluation at a minimum includes two tests, and one is a chromosomal microarray analysis, which I'm sure a bunch of y'all may have had done, and Fragile X testing. So those two things are where we start. If I see some other things, then I may go on to something else. And I'm going to say this little two words put together that I listened to when I heard you all speak, and we call it the diagnostic odyssey in genetics, because I listened to a whole bunch of people here speak about how much they went through and how many years they went through and how much testing they went through and who all they saw and the different states they went to, and genetic testing frequently is like that. However, I heard you say you saw my colleague Dr. Paul in the clinic. Somebody did. Who was it that saw Dr. Paul at
I
genetic?
did, Marie.
Okay, all right.
Marie.
And so one thing that we have now that can expand what we can see going on is that those exome studies. And the exome studies look at the exons, and that's the coding part of the genome. Now, it's only about 1%. It's not totally true. I'm saying that tongue in cheek, meaning that the exons, not all the coding parts are in there, but most of the coding takes place on the exons. It's only about 1% of the genome. The other part are called the introns. And so with exome studies, if we look at someone and we see, okay, there's some unusual phenotypical findings. We add on seizures. You all told me there was ataxia, there was regression. You all told me, I listened to all these presentations and saw your pictures, and there was a lot of things I could pull from the exam to add on to exome studies. So what we do on the exome studies is we put on not only developmental delay or autistic features, whatever, but we'd also put on those other things that you all had mentioned, like ataxia, that unsteady gait, or the regression, or changes in hearing, or you discover there's hearing loss, and all those other things that you all have mentioned. We put those on, and then on our request form, and then the beauty of it is the genetic testing companies can search on the exons for areas that code for those particular things. So it is a powerful, wonderful tool. It is not, I will tell you that we don't do exome testing on every child with the diagnosis of autism. We start with the Fragile X and the chromosomal microarray analysis. That's where we start, because frequently, very frequently, I find deletions and duplications, which are big pieces of genetic material, not just individual genes, because your children have, all of you all have talked, your children have have a mutation on a single gene in a single site. And that was found probably, and I'm listening to all your stories, I'm having a feeling most of this was found with exome studies. I have a feeling. Because in the past, we just had to pick a gene at a time. And Ms. Ramirez, you told me about all the different things you went through, right? Yeah. And
Everything,
oh,
X
oh yeah,
links and there was probably one
yeah,
of them.
yeah. And now, yes, and now with exome, yeah,
all of
you've been through all of it, yeah. And now with exome, it kind of makes us, it kind of takes us a little step further, but it takes a genetics evaluation to see if we see those unusual findings on the exam, and to try to put it all together in a big picture. If I see a child that every single thing as far as the physical exam goes is normal, except a socialization and speech delay, which meets the DSM criteria, I will start with the chromosomal microarray analysis in Fragile X, because the insurance companies talking about insurance approvals, and that's where we need to start. And I will tell you, I find deletions and duplications of genetic material in big, then the microarray analysis looks at big pieces of material, and so not just one gene. So I find that frequently, and I am generally the one that does the developmental delays in our department because I like it a lot, and so I end up doing that frequently. So I listen to all your stories, and I know it's, as I said, the diagnostic odyssey of genetic diagnoses. You all smile. I know you've all been through it, right? Yeah, yeah. And so I applaud you. And the beauty of all this, and you said, is the knowledge. And with X-linked conditions, you know about your daughters, you know about that sort of thing, and you know the future and that kind of thing. So that's the beauty of the whole thing. Somebody made a comment that made, wait and let the science catch up with us. Who said that?
That's what we were told.
Yeah, and it was the truth.
We were told that.
Yeah,
we were told that.
it's the truth. Yeah, unfortunately. Yeah, yeah. And now we've got exome. And you know where we're going next? We're going to go to genome. Genome will be next, and that looks at the introns and the exons. It's hard to get it. It's that the turnaround is not that fast. And exome, you said you had to wait quite some time for exome. We now get them back. I've gotten them back as early as 8 weeks now, which is just great.
I've got a
Yeah,
question.
we used to tell everybody 4 to 6 months. Now I'm seeing them back. I just got one back in about 6 weeks. I was like, what? So anyway, but the point I want to get across is that not every child we see with a diagnosis of autism needs an exome. But when I listened to you all, I saw other things going on there too. And in particular, when you showed me your pictures and you told me your long story, your story and how things went as the child developed and that sort of thing, and the regression and that sort of thing. I mean, sometimes they're very subtle things. So it takes sometimes a genetics, ear or eyeball to look at. And another thing that's really important is that family history, because we draw a pedigree and we can see those modes of inheritance. We can see that it's X-linked a lot of times, or we can see that it's autosomal dominant or recessive based on our pedigree that we draw with our genetic counselors. So anyway, I talked and talked and talked. I'm gonna quit talking and see if y'all have any questions.
I have a question for you.
Yes, ma'am. Yes, ma'am.
How long has it been since what did you call it?
Exome.
Exome. Yeah. How long has that existed?
I don't know how long it's. Let's put it this way. I came to UK. I was 30 some odd years out in primary care and certified in pediatrics and family practice. And I went back and got a clinical doctorate in nursing and focused in genetics and did training down at Greenwood Genetics Center and at UK. When I was doing my training in 2013, rarely was exome done. When I came to UK in 2015 and 14, exome was not being done at UK. Dr. Paul, I'll give him credit. He was the one who came and pushed it because he had come from Cleveland and it was common, and he's been there going on 3 years. So we are seeing it used. I mean, we use it. I use it most every day now. I think I ordered it twice. Well, today I didn't order it. Last week on last day I had of patients last week, I ordered exome twice in one day. So it just depends on, and a lot of it too is insurance approvals. I'll tell you all.
Oh, yeah.
Sometimes we got to go backwards, but commonly more widespread last couple years, and it's getting cheaper and faster. And the insurance companies were digging in their heels, and I'm seeing them back off a bit now and saying, yeah, because we can get an answer relatively quickly rather than going through this diagnostic odyssey, you know?
Mm-hmm.
So yeah. Was yours with an exome?
Yes.
Yeah, that's what I thought. When I heard your story, I said, I wrote down exome, I'm sure. Is what I wrote down when I heard you tell your story. Yeah.
I think Vicki has a question for us too.
Yes, go ahead.
This is also new to me. I don't know what questions to ask.
Yeah, hey, how are you?
Hi. But I guess what I want to know, because there's so many unanswered things with my granddaughter.
Sure.
She's just a mixed bag of a lot of different stuff. But the whole flat foot, awkward gait, you know,
Sure.
all that
Yes, ma'am.
stuff just applies. And what do you do to even get started and to get in to talk with you?
Well, where are you all from? Where are you from?
We're here in Lexington.
You're in Lexington? Okay. You can talk to your PCP and see if they'll make a referral to genetics.
Well, she's in a crisis situation now, so so this would be a good time to maybe get the referral going. But
Yeah.
I guess several of you guys were on a Zoom meeting today because she's in the hospital at Good Sam, and she comes home tomorrow. But you know, I guess what I want to know.
How old is she? Excuse me. How old is she?
She's 23.
Yeah. You could can we talk? Can I talk with you? What's going on with her with this group here, or would you prefer not to?
Yeah, I mean, most of you guys know that she's just she's got autism. She's got ADHD.
Vicki, you're on Facebook Live too, so keep that in mind.
Okay, so be careful. Be careful. Yeah. Thank you. Thank you.
Yeah.
So hey, Vicki,
Anyway,
well, let's do this. Why don't you ask your PCP to make a referral to us at UK Genetics?
Okay, so does it have to be the primary care physician, because that they're not somebody that's, well, anyway, can it be a psychologist? Can it be a
whatever your insurance is going to tell you to do?
Medicaid.
Right.
In Thatcher's case, it was a neurologist who referred us to genetics at Cincinnati Children's. So, so Vicki, you might be able to go that route with her being on Medicaid.
She's not seeing a neurologist right now. It's hard to get her to see anybody.
I tell you, we get referrals from, we get referrals from all over the place. And just like you said, we get referrals from neurology, cardiology, you name it, we get them. But some of the insurance companies say, your PCP has to refer you. So, you know, just check and see if she's Medicaid, just see what your Medicaid is going to require. You know?
Kentucky State Medicaid does not require it to be from your PCP.
Okay, there you go. There's your answer.
Okay. So because like I said, we've got a crisis thing opened on her now, so this would be a good time to ask for testing. For them to refer to you guys. But
Vicki, you'll need to check. But if there is no MCO and it's just straight Kentucky Medicaid, waivers, then you should be fine asking whoever.
But she's on the SCL waiver.
That's perfect. That means she has straight Kentucky Medicaid. So
right. Okay.
Now I will tell you, during this COVID time, it's kind of crazy because we're doing telehealth, and so all of our patients that were already on the schedule, my schedule was full for 6 months almost, and everything got bumped, and so we're rescheduling telehealth. So I don't know if it'll happen real quick because most places.
Oh, that's okay.
Okay.
We're used to that.
All right, so we're ready for you. I'll be looking for you. Nice to meet you.
Nice to meet you too.
Thank you. Thank you.
A lot of us are used to waiting because, like, I waited for 2 years for Thatcher to get the wheelchair. 2 years.
So it's craziness, isn't it?
Yeah, I mean, we first applied, and Medicaid just booted it right out. It was actually a good thing because we initially were going to go with a special needs stroller, but he was going to be too big for it. He's 6 feet tall now.
He grew.
Oh, yes. He grew very quickly, and his projected height for adulthood is 6'7" or 6'8". He's only 12.
Wow.
6 feet tall.
Huh.
Wow.
Yeah. So, and I can't pick him up anymore. And like, if he just lays down because his legs just aren't going anymore, there is no picking him up. He's too big. I can't.
I mean, do you do elderly people too? Because like my mother has Alzheimer's, and I take care of her. And I mean, there's something going on in our genes.
Yes, we do. And as a matter of fact, we do all age groups.
Mm-hmm.
And as I said, I'm certified in pediatrics, family, and genetics. So we do all, even though we're housed in Department of Pediatrics Division of Genetics at UK, we do all age groups. We probably, I'd say 30% of what I do is adults. I will tell you though that Medicare is reluctant to cover genetic testing.
Okay.
I'm just going to tell you that.
Yeah, that's fine. What is your phone number?
Actually, I'm sitting here at home, and I usually don't have a card, but there happens to be one sitting here. UK Genetics is 859-323-0396.
Okay, thank you.
Okay, you're welcome. Yeah, nice talking to you.
Nice talking to you.
Yeah, thank you. Anything else? Any other questions about the testing or
questions for our presenters?
When we got our testing done, like I said,
somebody was asking a question?
I think that was Mel.
Okay.
Do you guys, when you do the testing, does it require a blood sample?
Oh, are you asking me that, Melanie?
Yes.
Okay.
Yes.
It just depends. We can do a cheek swab. It depends on the test and depends on what we're doing. Our genetic counselors are the experts on that. And they always they will always talk with the family before we do genetic testing and get consent, because genetic testing is a little bit sensitive, and we must get consent beforehand for the testing. A lot of it can be done with a cheek swab. And so that is always a question, because some of the children that we see, and even the adults, it's a little difficult to get blood draws. So there are options a lot of times, and frequently we could do cheek swabs. But exome is commonly done with a cheek swab. Yes.
Chris had blood drawn, and they did cheek swabs for his mother and father.
Yes, and they will usually do that as a follow-up. But sometimes we can do them all three like a cheek swab. So anyway.
Okay, good.
And I will tell you that I will flat out tell you this, that most centers are like this. We have to get the insurance approval before we do the collection of the samples, because if we do all this and then the insurance turns it down, then we have gone through all that about collecting the sample and all that kind of stuff. So we get approved. It's always pending the insurance approvals.
Right. Good.
Yeah. Sometimes that takes longer than the rest of it. So kind of crazy.
It looks like Lisa had a question for us.
I even turned on my camera.
Awesome.
Oh, hi. How are you?
Hi, I'm good. How are you?
I'm fine. Thank you.
I was lurking quietly. You talked about hands and feet. And I wonder if you want to talk more about hands and feet. You also said ears. I'm not as interested in that, but tell me about hands and feet. And then before you answer that, I just want to clarify that you need a referral and you need to see a person. Mm-hmm. And maybe you're doing some of those exams via telemedicine, although it's 6 months out. And is that the point that you ask for the prior authorization before the testing is done?
Okay, what we do is the provider, we have genetic counselors, and the genetic counselors is kind of a neat profession. They are brilliant in regards to genetic testing, and they know everything about inheritance and that sort of thing. And they are trained in how to give the results, and they're trained in the ethical implications of genetic testing too. We try to, and they are very good at getting the family histories and drawing the family pedigree. So ideally, they would see you first, the provider sitting there right behind them, like myself or Dr. Paul, one of the physicians, and then we come in, they come out and show us the pedigree and give us the history, and then we come in and we do the exam and get more history and go from there. And then depending on what we see, we make a decision on what kind of testing. There's so many things. I can't, I mean, really think about it. If you look at hands, there's a lot of different things. Short fingers, long fingers, twisted fingers, turned fingers. You know, there's all kinds of, there's whole volumes of books written on findings. No toenails, yes toenails, small fingers, bones missing in the hands. There are a myriad of things we look for. So it's a real picky exam that we do. That makes sense?
Yeah, I mean, for me, thinking about Alicia, the whole double jointed stuff with her hands and her feet, like when she walks and then she, you know, goes straight with her left and her back, you know, right foot is turned and her awkward gait. And that is how, when she was in the Ridge, the Dr. Humphreys had her like stand on one leg and hop, and she said she's mildly just you know, intellectually disabled. She said she's mildly retarded, and it just blew us away. She could tell just by that.
Yeah, well, so there's a lot of things we look at, and I want to add on to you with you all that frequently we don't find anything frequently, and you all have been through this diagnostic odyssey, know that. Right? Yeah. But a lot of times we do, and parents are like, oh, thank you.
Because it explains so much,
yes,
especially when you see generations of like my mother and me and my daughter and Alicia, you know, all having just, you know, issues of different things.
Right. So anyway, it's interesting. It's a very interesting specialty, I guess you could say it. Yeah.
Sometimes we're just shocked when you have found something, because
I know you're exactly right, and I applaud you for saying that, because parents are like, what? We've been going through this for, I have kids, I have adults that I have seen, and they've been going through this for years, just like, you know, you all been through this. Right. And they're like, wow. Well, and to give credit where it's due, our testing capabilities are much more refined now, and we've got more options for testing too. So
right,
you know,
and that's why I thought it was important to do this now, because there's a lot more information that we didn't have just 5 years ago.
That's exactly right.
And so in our case, I thought it was our second round of genetic testing. The first round they ruled out Fragile X, and that was 3. And so I was like, I am positive they are going to find nothing. There is going to be nothing. But they wouldn't tell me anything until the appointment.
Right.
They wouldn't say, yes, we found something. No, we didn't find something.
We don't. Yeah.
Right.
Because it's awful hard to explain this on the phone.
Right.
You know?
And then they came in, and it was this room full of people. It was like 3 people. They come in, and they have this binder. The binder was like this thick. And they're like, okay, so this is what it is. It is, we found something. It's Christensen syndrome. And then they explained it to me exactly how that works and what it is and how the genes work and everything with their big binder. And then they gave me 2 sheets of paper, and it was a printout of the Christensen Syndrome Association website. And they said, well, here's where you can find some information on your own. And this is all we know. Good luck. See you next year.
You know, right. And unfortunately, some of these things are so rare, as you all have found out. There's only X amount of cases in the whole world, you know. And I have found, one thing I have found out, that you all are the experts. You all are the experts on this. particularly in these very rare conditions. You all are the experts.
You say that, it's kind of interesting because one of the things that changed significantly for us right after Thatcher's diagnosis of Christensen syndrome is that doctors began to listen to what I had to say. Where before, like, Thatcher had these weird nosebleeds. We couldn't figure out what was going on, but he would roll his eyes back, and then he would have a nosebleed. And we knew I knew personally that was seizure related. And I had to take him to the ER several times because we couldn't get the bleeding to stop.
Right.
I put him on an iron supplement to help with the lost iron from the blood loss. And every time we would go into the doctor, they would say, oh, well, he must be picking his nose, or it must be allergies. And I'm like, but he doesn't pick his nose. And allergies that doesn't happen with allergies. Your nose just doesn't bleed uncontrollably because of allergies.
Right.
So,
yeah.
So we actually did go to UK where we were seeing neurology there. We were going to do a 3-day EEG. And the neurologist there dismissed my concerns about the nosebleeds. And so then we went to Cincinnati Children's. And that is, we had a better neurology team there. Not saying like everything at UK is.
I'm fine with whatever you say.
Right.
Don't bother me. Just so you get taken care of.
Right. Some departments are better than other departments.
Sure. Yeah.
Every hospital you go to. And in our case, the neurology department at Cincinnati Children's was much better at listening to my concerns, and they were actually the ones who sent us to genetics. So I was quite shocked when they said, "Oh, well, it's Christensen syndrome." And then other parents in the Christensen syndrome group, I asked about nosebleeds in their children, and they said, "Yeah, we have that too." And I was like, "Interesting."
Interesting, huh? And as a member, I said, you all are the experts.
Right.
I tell parents that all the time. You all are the experts. We may be able to look up all of our genetic stuff and may have seen 1 or 2 cases or never seen it, just have read about it. You all are the experts because you're there every day.
Right.
Well,
right.
Yeah.
And people didn't understand why exactly Thatcher needed a wheelchair because he can walk. He doesn't need it all the time. So now I can actually have an answer. I can explain, he's got this condition. It causes him not to be able to walk as far or as well as everybody else. So here we are. We've got a wheelchair for when he needs it. Now I do allow him to walk as much as possible. I don't know how much you know about Christensen syndrome, but it's regressive. So,
I saw that. Yeah, I looked it up.
So I know that he is going to, and he's regressed in the past. So I know that regression is more than likely going to occur in the future, as it's already occurring with his walking abilities. So now I at least know what to look for.
Right.
I'll add this. I'm a member of a group for CDG, which is more people than just the PIGA.
Hi. I couldn't see who was talking. Hi.
Okay,
Yes,
hi.
ma'am. Hi.
But they are doing a fundraiser to get funding for research on PIGA. And so I'm glad I know about it and I can contribute to that, and that, hopefully they will find some way to treat it in the future. But I think it's only been since 2006 that they had identified PIGA. And so it's a new thing, and I'm hopeful that they will be able to find some treatment. It's probably not during my son's lifetime, but I think that they may be able to find something using research.
Right. And I have patients ask me, and parents ask me, and family members ask me all the time, what do I think about, the clinical trials? And I think one of y'all mentioned something about a clinical trial. I think it's great. I think it's great because what you just said may not in my lifetime, however, down the road. And I have patients and parents and spouses, because I do all age groups, ask me all the time. And we try to guide them that direction if they are interested.
I mean, I told Dr. Paul that I would be, Chris would be available if there are any clinical trials or anything, we'd be willing
Yeah.
to participate
Yeah.
just for other people.
Sure. Yeah.
Made it to 45 so far. So
yeah, that's great. That is great.
Mhm.
I applaud you.
Yeah, he's doing great.
Interestingly enough,
What did you say?
I said, interestingly enough, we're talking
Yeah.
about things that we won't see in our lifetime. So I thought that Thatcher in our lifetime would not have a genetic diagnosis.
There you go.
We don't know what's going to
Yeah.
happen in our lifetime. There's no crystal ball.
Yeah.
Um,
Yeah.
So maybe it won't happen in our lifetime, but maybe it will.
Yeah.
You never know.
It might. Yeah. And
But
I
we
really
have to
think that
forever.
the advances we're seeing with testing, we're gonna see even more things, and it's gonna be faster and it's gonna be cheaper. It's just like when the first computer came out, you know. I mean, it took up a whole building. Remember when the first cell phones out, they were a great big old bag we had to carry around, you know. So I really am confident that genetic testing will be more affordable and more available in the future. I really think so. But there is always an ethical component to it, you know, finding out the modes of inheritance and who's going to have this and how you report that and that sort of thing is an emotionally charged thing. So we have to consider those as we report them and discuss them. So.
Well, I feel like, you know, if people choose to know, then that's one thing. If they choose
Right.
not to know, then that's just what
That's
they
right.
choose to do.
That's right.
And
That's
I'm not going to fault
exactly right.
anybody for their choices.
That's right.
Yeah.
And that's what we go with, you know, in genetics. Most of
Right.
the time. Yeah, we go, yep, if you don't want to know or you don't, you know, that's fine. That's
Right.
fine.
So I actually learned quite a bit about my family before Thatcher's genetic testing. I had already mentioned Thatcher and I both have celiac. That's genetic. It's an autoimmune disorder that's genetic.
Mhm.
My sister has Hashimoto's, also a genetic autoimmune condition. And several people in the family have Ehlers-Danlos type 3, which is the one you can't see on genetic testing, unfortunately.
Right.
But,
Right. Yeah. Right. Yes.
Stuff.
Mhm.
And
You can do that?
do what?
I just said you can make that.
Yeah, I can make that touch my arm right there. See?
Oh, wow.
Yeah,
But
that's
you had
not supposed to happen, and I'm not supposed to be doing it, but I just wanted to show like what the body can do if it has this connective tissue issue. But what I was going to say was I also found that my family, on my through my maternal grandmother, we're related to the Blue Fugits of Kentucky.
Are you?
Oh yes,
I know about that. Are you really? Where are you from? I'm sorry I had to break in there, but where are you from?
So I grew up in Jeffersonville, Kentucky, which is Montgomery County, but my grandmother grew up in Breathitt County.
Okay.
So
yeah, they're from over there.
Right
Yeah.
in Troublesome Creek.
Yeah.
So,
Wow.
Yeah, and I found that out through my own research. If you don't know, it's a rare genetic blood disorder, and the last reported case was in the 1970s. And the reason why it happens is because they were mountain people and they inbred. So, yeah. So it kind of makes it really interesting, especially for genetics, because we have all of these genetic conditions. Ehlers-Danlos type 3, well, all Ehlers-Danlos, but our condition. Ehlers-Danlos is rare also. So celiac's not rare, but Christensen syndrome, and I'm a carrier, Christensen syndrome and Ehlers-Danlos are both rare. And so I was like, well, that's weird. We have two rare conditions in the same family. What is going on here? There's something more to this. And so I'm going to throw this out there. One of the things that I've been working on in my spare time, which I have not very much of, besides, playing Stardew Valley, I've actually been working on doing research to write a memoir about Thatcher, and specifically about what our genealogy can tell us about our genetics. So I'm still in the research part of that. And I've talked to several families who have rare genetic conditions that I know personally about that project. So it's going to be a while in the making, but I have some plans, and I'm moving forward with it.
Pretty neat.
Yeah. So it's not going to be like in kind of a scientific-y form. It's going to be more like memoir, like creative nonfiction, because that's what my degree is in. But there will be science thrown in. It'll be there, but a lot of it's going to be just relatable kinds of things for families who have these rare conditions, and what kind of that odyssey journey. I actually found out about it was so weird. I found out that we were related to the blue people, blue fugates, because I was watching Mysteries at the Museum. It's a travel channel documentary series about like odd things at museums, and they mentioned it, and I was like, wait a second, because they said Breathitt County, Kentucky, and I was like, wait a second, my granny grew up there. And so I started digging in her family tree and going back through the female line. I've traced our female line all the way back to New England, and I can't get any farther at the moment. But I wanted to know, like, how far back do all of these genetic anomalies go? And
oh gosh, who knows?
who knows? So
When we do our pedigrees, we do at least 3 generations, and we get an idea. So that's where we and sometimes we do 4 and 5, depending on if we start seeing things. There's some historical studies that go back for generations and generations, and depending on the mode of inheritance, whether it's autism or recessive, if you're recessive, you have to have 2 carriers in order.
Right.
So anyway, a lot of times that'll be somebody just floating around, and all of a sudden they have children together, and it's the luck of the draw. Or if you live in a very close-knit community, that may be in the community, and people may be closer related than we think. And certain, if you look into the genetics literature, there's certain should I say cultural groups that are very like the Amish societies. Okay, they're very small, or the Mennonites, or the French Canadians, or who's the group down in New Orleans? The Cajuns. Okay, so there's things you'll see that are in certain groups. So bottom line is, who knows?
Right. And so so because you're saying who knows, that's the reason why I wanted to do some investigating. Where I'm stuck, I have to talk to, and hopefully this will actually work, the Mormon Church, because apparently they have the best genealogy records.
Yes, I bet they do. Yes. So, for many generations.
Right. So I was trying to figure out how to come up with a plan to go and visit the Mormon temple here in Lexington to see what I could find. And before I got all of that in place, COVID-19. So.
Oh, of course. Yes. That's put a kind of halt on everything. Yeah.
Yeah. So everything's kind of been put on hold.
Right.
But we'll see. I think it's going to be kind of interesting as I go through doing the research side of it. So we'll see. We'll see how that goes. But yeah, I'm related to the blue people.
That's interesting. All right.
What's really interesting is that when my son gets really cold, his fingertips, his lips will turn blue. And I don't mean like it's like, you get in a cold pool, and most people, they're like, oh, I'm shivering, but then they kind of get to where they're comfortable with the temperature. He never gets comfortable with the temperature, and his lips and fingertips and those. So mean, that's a little more so than your average person. Your lips aren't supposed to turn blue just because you got in cold water. It's got to be icy for that, right?
Mm-hmm.
But no, his is just because of cold water. He hates the cold water pool. I don't blame him.
Hey, Deborah, I have a question for you. Deborah Ramirez. Hi. I have a question. Tell me again your condition with your boys, your 3 boys. What was it again?
I'm sorry, say that again.
What was your condition that your boys have?
Christensen syndrome.
They both, okay, so both you all have them. Okay.
Mm-hmm.
That's what I thought.
Yeah,
and I thought, no, both of you didn't say that, but you did. Wow. Okay. Interesting.
Yeah, I'm the only one, I believe, that have 3 siblings.
Right, right.
Yeah, so that's where I met Deborah. I met her.
So I was wondering, I thought y'all both said that, and I thought, no, they didn't. Yeah, they did.
Yeah.
Okay. All right.
Did.
Yeah.
Marie, I met through Autism Society. Deborah, I met through Christensen Syndrome Association.
Mm-hmm. Okay.
So
all right.
It leads you to some interesting people. These rare diagnoses.
Right, right. Well, I'm going to have to head on, you all. I've got to get ready for tomorrow's clinic. So it was an honor to meet you all and spend some time with you.
Before everybody leaves, I just have a really quick request. If anybody knows anybody that they think would be good, would be interested in coming to do respite with my granddaughter, it's a matter of, we live off of Boston Road, and I need someone from 10 until 6. And for that, they would be paid $9 an hour basically to come in and sleep, be there with her when if she wakes up. Just she's coming back from the hospital tomorrow, and I think they're saying that they really made it easier to get approved, like with this emergency situation. If anybody knows anybody that would be interested in doing that, call me.
Okay.
I think it'd be a good job to go.
It does. That's actually a real good job. Yeah.
So anyway, if you know anybody or would care to put it on Facebook, we're looking just for somebody really quick. Not just anybody, but somebody that would be a positive. She's 23 and she has a lot of anxiety issues, and well, you all know her pretty much. So that's all. Thank you. This was really a good meeting. Thank you.
Thank you. And thank you, Delwyn, for coming and talking to us.
Yeah.
You're welcome. I hope that was a little helpful and kind of clarify, the testing that we do and where we're going and what we're thinking. So
absolutely.
It was very helpful because I haven't been able to know what questions to even ask, but now I might have 1 or 2.
Okay. All right.
So thank you.
Well, thank you all. And I thank you all for, I always applaud you for everything you all have done too. So I know it's a challenging, tough time, and when these things come up and you can't figure it out, So thanks. It's an honor.
Thank you.
You all take care. And y'all, if you need anything from us over at UK and Genetics, we're there.
Thank you.
Okay. And thanks for the invite. I appreciate it.
And if anyone wants to stick around to ask our 3 guest speaker questions, please feel free to do so. We've got a few more minutes left that we can be on our Zoom. So you can feel free to stick around if you'd like to ask questions or whatever you'd like to do.
I can't think of anything. I'm really tired, so but I love this Zoom. I mean, I would love to keep on having our meetings, this, because I could never make it, being able to, get out, and since I take care of my mom. So.
Well, that's definitely something that we can bring up to the board, to be able to be able to host our meetings this way, even once things go back.
Right.
We say normal, but there's no such thing.
Yeah, there's no normal. Thank you, guys. I really appreciate it.
Thank you all.
Okay, bye.
So, anybody else have any questions for our guest speakers before we go?
No, but I will say you were awesome, and it was really interesting to hear you talk, and thank you.
Who's that speaking?
My name is Lissa.
Where are you, Lissa? I don't see you. What are you up here as?
There. It says Evan.
Oh, hey,
Evan.
hi. I was looking for you again. Okay, all right. And the hand thing, there's a lot of things we look for, a whole lot of stuff. So it's just not one thing. It's shapes of fingers, extra bones, missing bones, no fingernails, long fingernails, short fingernails. I mean, there's a lot of things. So it takes us a long time to learn it too. You know?
Yeah, how do you keep track of all of that? I wouldn't be able to keep track of it.
It takes
it's really
a lot
interesting though.
Yeah. So anyway, nice to meet you all, and thank you so much. You all take care.
You too. Nice to meet you.
Okay. Yeah, I'm gonna go ahead and sign out. Thank you. Let me know if you need anything else, okay?
So we're still, I'm going to stick around for any other questions too. I usually, whenever I do a Zoom meeting, I usually stick around for a few minutes. But does anybody have any questions they'd prefer not to be on the camera? If you do, just give me a quick raise your hand. Because I can totally turn that off. I can turn off the Facebook Live if necessary.
Are we done with Facebook Live?
I haven't turned Facebook Live off yet, but I can.
That's a great job. Excellent job. Really, really cool.
I just want to make sure that everybody's questions get answered. And if you do have, I am going to go ahead and stop the live so that if you do have questions that you prefer not to be on live, that you can do that. You can ask those. There we go. All right, so I've stopped the live stream.